Zambo, and a very warm welcome to 𝗃𝗏𝗧 in English. I'm Thong, and today we will discuss about sinusitis, commonly or locally known as 𝗗𝗵, and it is a common condition we encounter within our social circles, among families, relatives, friends, and people we know. And therefore, this episode aims to understand its causes, symptoms, and most importantly, the effective management strategies. And we will also address some prevalent Bhutanese beliefs associated with its triggers, causes, and treatment. And to guide us, we are joined by Dr. 𝗵𝗂𝗂, an ENT specialist from the JDWNRH. Thank you so much, Doctor, for joining us today. So, Doctor, before we delve into sinusitis, can you please explain to our viewers what the sinuses are, their location, and their function?
Thank you, Thong, for the opportunity to take part in the weekly 𝗃𝗏𝗧 program. So, as you said, today the topic is about sinusitis, which is quite a prevalent condition in our context. One of the most common nasal conditions that we see in our OPD at the National Referral Hospital. When we talk about sinusitis, the word sinusitis, so basically we are talking about sinuses. So, sinuses are nothing but they are small bony cavities which sit around the nose.
Yes.
So, if you look at the nose itself is a chamber which is surrounded by sinuses. So, sinuses are bony cavities. So, there are actually 4 pairs of sinuses. So, we have the maxillary sinus, which is right up front just beside the nose, which is covered by the skin and other tissues. So, we have the maxillary sinus cavity, then we have the 𝗏𝗏𝗧𝘀𝗵𝗏 sinus, which is just again adjacent to the just medial to the maxillary sinus. As you go behind, then there is something called a sphenoid sinus, which is quite near the brain. So, once you pass the sphenoid sinus, you will encounter the brain. And likewise, in the front, just above the maxillary sinus, we have something called the frontal sinus. So, in total, we have 4 pairs of sinuses. The most significant being the maxillary sinus, which is the largest, and then followed by other sinuses, 𝗏𝗏𝗧𝘀𝗵𝗏 frontal and sphenoid sinuses. So, basically these are air-filled bony cavities. Ideally, the sinuses should function well. So, meaning we have some secretions, natural secretions within the sinuses. So, all the sinuses will ultimately open into the nose. So, there are different pathways within the nose where each of the sinuses will ultimately drain inside the nose. So, what happens in sinusitis? This drainage is not happening as expected. So, sometimes there are issues associated within the sinus where the secretions and drainage are not being expelled in the natural way that it should happen, or sometimes because of some issues where the sinuses are getting blocked. So, the pathway of the sinuses are getting blocked, because of which there is no proper drainage of the sinuses. So, the sinus opening into the nose is vital for 2 things. First thing, proper drainage of the sinuses, for the secretions to come naturally to the nose, and second thing, proper ventilation. So, the sinuses, as I said, are bony cavities which are air filled. So, there should be proper ventilation within sinuses. So, because of some issues when this does not happen, then there is accumulation of secretion within the sinuses which can get infected and can ultimately lead to sinusitis.
So, Doctor, are there any external factor that causes or triggers a sinusitis infection?
So, actually when we talk about something external agent, it is again ultimately at the end of the day, it all depends on how your body responds to an external agent. So, that brings us to the topic of allergies when we talk about allergies. So, in the environment we are exposed to different allergens. So, if you take a person A, he may be allergic to some dust mite. A person B might be allergic to some food material. A person C may be allergic to some drugs. So, likewise in the environment we have different kinds of environmental exposure. So that's what you mean by some external agent which causes sinusitis. So it all depends on what you are allergic to. Some person may be totally normal, but some may be allergic to some dust, some may be some allergic to some pollen, some may be some allergic to some other materials, you know, which occurs in the environment. So if you are allergic to certain kind of material or certain kind of substances, then it is basically your body reacting against that particular agent. So that will differ from person to person, but it can trigger a reaction within. Now, for example, if you are having some kind of allergies, then when you are exposed to that particular allergen from the external world, then you might exhibit some symptoms. For instance, for typical nasal symptoms are itchiness of the nose. You'll develop excessive sneezing because of the allergen. You might even experience nasal blockage. So these are all manifestations which are triggered by allergen, but which your body reacts. Your body is responding to that particular allergen, and this is how the overall cascade of the things happen because of an allergic induced reaction.
What about pathogens like virus, bacteria and fungal?
Yes.
Does it contribute to sinusitis?
Yes. Yes. So that is again, you know, there has been a major shift in the way how we understand sinusitis. If you look back 10, 20 years back, our understanding about sinusitis is mainly on the assumption that sinusitis is an infective condition, meaning sinusitis is caused by an external, you know, pathogen like a virus or bacteria or whatever. But now our understanding about sinusitis have drastically changed. With improved understanding, a lot of research coming into play, our understanding of sinusitis has drastically improved. So we, at the moment, we no longer consider sinusitis as an infection. So sinusitis is basically a chronic inflammatory condition. So this has been going on, it will go on, and then in addition to that already pre-existing condition, which is a chronic inflammation, you might in addition have some infection, superadded infection. So supposing I may be having chronic sinusitis throughout with me, one fine day there is an exacerbation of my sinusitis. So on top of my chronic sinusitis, because of some pathogens like bacteria, virus, I might my sinusitis might as well turn into an infective kind of sinusitis, where you know there is infection going inside my sinuses, where I might have some severe symptoms of sinusitis. So for instance, I may be having some allergic related kind of sinusitis. I may be having sneezing, some watery nose, and one fine day I might develop some pain, fever. So that is an indication that some infection is setting in. So infection per se do not define sinusitis. So sinusitis is overall chronic inflammatory condition, on top of which you can have some added infection, like and it can be because of bacteria, viruses and fungus, especially if you are immunocompromised, and you are having possibility of a fungal sinusitis even more.
Yes. So doctor, before exploring the symptoms of sinusitis, are there types or stages of this inflammatory condition?
Yes. So like in any other, like in most of the pathogenic processes which occurs in the body, so sinusitis also have different stages. But before we go into that, it's important for to understand what do you actually mean by, because sinusitis can be either an acute condition or it can be chronic. So there are two broad categories. So in acute sinusitis, what happens is you might develop acute symptoms. So you will have acute symptoms related to sinusitis, and once that acute episode settles, then in between you're okay. You don't have additional features of sinusitis. Whereas in chronic sinusitis, you may be having that the symptoms which can exist with you for quite some time, chronically for months.
Yes.
So that's how you would differentiate acute versus chronic sinusitis, and also the mechanism, the way how it happens, the pathogenic process also differs, in between the two. For instance, in acute condition, normally there is also a superadded infection.
Yes.
So apart from your background of sinusitis, you might also have a infection going on there, and you might need a different kind of treatment for that. Whereas in a chronic sinusitis, the pathogenesis is such that there may not be infection, but you will have your chronic inflammation going on, because of which you will have chronic symptoms.
Yes. So what are the major symptoms, and how do we differentiate the symptoms between acute and chronic sinusitis?
Okay. So some of the predominant symptoms, what we call as the major symptoms of sinusitis, are mainly nasal blockage.
Yes.
So nasal blockage is one of the main indicator for sinusitis. We also, in addition to that, somebody will also have, sometimes you can have loss of smell. So you may not have adequate sense of smell. So what is also called the anosmia, or loss of smell. Sometimes you will even have discharges coming from the nose.
Yes.
So particularly some pus discharge coming from the nose. So these are some of the major symptoms of sinusitis. We also have something called minor criteria or minor symptoms of sinusitis. This can include some very non-specific, for instance, headache. Those days, headache is considered to be a major symptom of sinusitis, but that's not proven to be so. Now, headache is one of the minor manifestations of sinusitis, and you can have headache and some other non-specific symptoms. But the main symptoms are nasal blockage, loss of smell, and maybe nasal discharge coming from the nose. Now, how would you differentiate acute from a chronic sinusitis? In acute sinusitis, your whatever symptoms you have, there is exacerbation or exaggeration of symptoms. So you may be having some kind of nasal obstruction, but when you have acute, you have severe nasal obstruction. You might have severe nasal discharge. In addition, in acute condition, as I said, there is a high possibility that there is an infection also going on with the acute sinusitis. So because of that infection, you will have additional symptoms, like you might have even fever because of the infection. You might have other constitutional symptoms. So that's how you would differentiate acute from a chronic sinusitis by the way of symptoms, based on the severity of your symptoms.
So, Doctor, hearing from the symptoms that you shared, it somehow overlaps the symptoms of flu and fever. So, what advice do you have for our viewers?
So, it is very important to differentiate. Now, there are two conditions. One, we are talking about sinusitis. We are talking mainly in terms of the sinuses around the nose being affected. There is also something called rhinitis. So rhinitis is limited only to the nose. The sinuses are free from disease, but there is some kind of infection going inside the nose. So that corresponds to your typical flu-like symptoms. So when we have flu-like symptoms, it's basically our nose is affected, but sinuses are usually not affected. So you will have similar kind of symptoms, again, a runny nose, nasal blockage, all these kind of things. With regard to prevention, for sinusitis, the most important thing is treatment. Why? Because, say, if supposing somebody is having some kind of allergic related kind of sinusitis, it's very, very important to control that allergic symptoms related to sinusitis. The reason is because, after all, our nose is the airway, it's the beginning of the airway, and it terminates into the lung. So there is a whole passage of airway which are interrelated to each other. It starts from the nose and ends in the lung. So when we have a common pathway, and when one part of the body is affected, when the nose, the upper airway is affected, it can trigger a similar kind of reaction deep down within the lungs. So if you cannot, or if you do not control your nasal symptoms, it is possible that you might trigger a kind of reaction within the lungs also. So that's why we see that somebody who have allergic rhinitis or sinusitis related to allergies have more propensity to develop a lower respiratory tract condition like asthma. So compared to some normal people who don't have any kind of allergic related kind of sinusitis, you have higher propensity to develop. If you have your nasal symptoms related to allergens, and if these are not well controlled, you have more chances of getting some lower lung conditions like asthma, bronchial asthma.
Yes. So doctor mentioned that we have a total of 4 pairs of sinuses. Do all sinuses gets affected, or can only a part of sinuses get inflamed? And does the location of the inflammation influence the intensity of symptoms?
There is not much difference in the severity of the symptom, but which sinuses get affected is it is very very variable.
Yes.
But if you consider all the 4 sinuses, then the commonest sinus which gets affected is the maxillary sinus, the frontmost part of the sinuses. And there is a reason for that, because as I said, ultimately all the 4 sinuses will ultimately drain inside the nose. But if you look at the drainage of the maxillary sinus, which lies just behind the nose, so the drainage of the maxillary sinus, the fluid has to flow up against gravity. So the opening of the maxillary sinus is a little bit higher up and it's not lower down. So that's why the drainage of the maxillary sinus can get hampered easily compared to other sinuses like frontal sinus, ethmoid sinus, sphenoid sinus, which are at a higher level compared to the nose. So their drainage is facilitated by gravity. So whatever secretions there, it is easier for those sinuses to drain inside the nose in comparison to a maxillary sinus, where the sinus opening is a little bit situated upwards, and then the natural drainage pathway can get hampered easily for maxillary sinuses. So that's why, compared to other sinuses, maxillary sinusitis is the commonest compared to other 4 sinuses.
So doctor, how do we confirm the sites on which of the sinuses is infected or inflamed?
So
are there any exams or tests that you run through?
So those days, when we don't have endoscopes, we rely typically on X-rays to diagnose sinusitis. So even 10-15 years back, even when I was undergoing my training, most of our experience is based on doing X-ray on the patient, and then looking for the sinuses in the X-ray film to diagnose sinusitis. But nowadays these are things of the past. So we no longer rely on X-ray for diagnosing sinusitis. The reason is because X-ray, it has a lot of side effects. I mean, it has adverse effects because you are being unnecessarily exposed to radiation, which can have long-term adverse effects. So that's why now we try to go for less invasive and something more straightforward and less harmful for the patient. So nowadays we rely mainly on endoscopes. So if you visit any of the ENT OPD in the country, starting from the National Referral Hospital, then the regional referral hospitals like in Mongar, 𝗘𝗏𝗧, and also a district hospital like Phinseling, where all of the ENT OPD setup is now equipped with endoscopes. So we have something called nasal endoscope, where we confirm the diagnosis of sinusitis. So sinusitis is basically a clinical diagnosis. We don't need any hi-fi equipment to actually diagnose sinusitis. Most of the sinusitis diagnosis is mainly by clinical means. So we get a proper history from the patient, and then we will do a nasal endoscopy to confirm that finding. So we no longer rely on doing a X-ray to diagnose sinusitis. Having said that, so doing a nasal endoscope will tell us there is a possibility of sinusitis. And then most of the treatment we can do non-invasively, but sometimes if we need surgical kind of treatment, then we might even go for an CT scan just to map the disease and see which are the sinuses actually affected before we actually go for more invasive intervention.
Yes. So doctor, some people are seen to have sinusitis for quite a long period of time, and my question here is whether sinusitis is a lifelong condition, or perhaps people mistake it recurrent sinusitis as a long-term condition.
So you are very right in saying that sinusitis can be long-term because it's a chronic condition, you know. So it's basically nowadays we don't consider sinusitis just as a local condition, but we consider as a systemic condition. So which means somebody can be chronically affected by sinusitis. The important here thing is to control the symptoms, and when you have sinusitis, it's very important to differentiate whether your sinusitis is associated with some other additional growth inside the nose. So what we call as the polyp, nasal polyp. So your sinusitis can be either polypoidal, meaning there is some extra mass of growth inside the nose, versus a straightforward sinusitis without any growth. So if somebody has an extra growth inside the nose related to sinusitis, this is called polyposis, then we have to get that treated. And the only straightforward logical way of getting treated for that is to get surgically removed, to remove the polyp inside the nose surgically. And then once you remove you know, the polyp or whatever mass inside, then you can apply medication, and then you might get relief. But main thing here is to first of all differentiate what kind of sinusitis is there, and then accordingly we will tailor make the treatment for that particular patient.
Doctor, are there any other treatment options for sinusitis, or is it treatable or manageable at home? If it is, then are there any self-care tips that you have for our viewers?
So with regard to treatment, most of the sinusitis, almost say 80–90% of the sinusitis can be managed without surgery. So only a percentage of people, 10–15% of the patients suffering from sinusitis might require surgery, but majority can be managed without surgery. And the principle of treatment that we are talking here is about controlling the inflammation. So as I said, chronic sinusitis is a long-term chronic condition. It's an inflammatory condition. So we need a medication which will take care of the chronic inflammation. So that's why applying proper medication long-term is very, very important to control your symptoms and also to keep the disease, to stabilize the disease. So that's very, very important. So most of this can be managed by using medication. Apart from medication, you can also have some home remedies, as you really wanted to know more about the home remedies. That is in the form of nasal rinsing or nasal douging. So basically we are trying to clean up the sinuses, clean up the nose with some home remedies. The common approach that we recommend to our patients is to use some salt. You take some lukewarm water and add a spoon of salt and spoon of baking soda. You mix it well, and then you syringe or you flush it inside the nose to clear the sinuses. So that will again ensure that your sinuses are being well ventilated and well cleaned. So failing all these conservative measures, then we would ultimately even consider surgical option, because you know sometimes whatever medication, the goal of treatment in sinusitis is whatever medication you are applying, it should reach the area of need. So we have sinus opening inside the nose. So your medication that you are applying should reach there, and it should act in that particular area in order to clear the sinuses. But because of some reason, say supposing you have an extra mass or extra growth inside the nose, which is preventing the medicine going inside the nose, inside the sinuses. So then no matter how much you apply, it may not reach the sinuses well. So then it defeats the entire purpose of using nasal sprays and other medications inside the nose, if there is a mechanical obstruction to the delivery of your medicine. So then that's where we recommend removal or surgery to take care of, to remove the mass, to create a way for the medicine or the spray to go inside the nose, clearing passage, and then making use of the medication to be more effective for the long-term management of sinusitis.
Yes. So doctor, talking about management, are there any dietary restrictions that people need to be aware of? Because in Bhutan there's a common belief that fermented foods like alcohol, pickles, aged cheese and dried fish can flare up or worsen sinusitis or trigger sinusitis. So, and moreover, the traditional medicine also advises against taking these foods. So are there any scientific backups or evidence for that?
Yes. So as far as dietary restriction in sinusitis is concerned, mainly with regard to allergens. Now, if normally our standard dietary advice for somebody with sinusitis is, you try to avoid those food material or whatever if you are allergic to that particular substance, because if you are allergic, definitely you have to avoid, because an allergen can trigger an episode of sinusitis. But as you rightly said, we have a lot of anecdotal evidence, mainly in the form of Bhutanese diet, like fermented cheese, dry fish, a lot of food items which can trigger, which according to most of the patients can trigger an attack of sinusitis. And there is again no hardcore scientific evidence to prove that. It's very anecdotal, but we feel that again a component of allergen plays there, because whenever you are allergic to some kind of substances, it will trigger an attack of sinusitis. It will make your symptoms more worse, and it can exacerbate the entire process of sinusitis. So at the end of the day, you are your best guide. If you know that certain kind of substance can trigger an attack, I think the best logical thing to do would be to avoid that. And then at the end of the day, that will be more effective. You may not have to rely on even on medication for long term if you can prevent that way.
Yes. So according to our medical expert, there's no evidence to suggest that fermented foods are correlated or can directly cause or flare up your sinusitis. So the key takeaway here is that moderation is key in any diet. So with continuation to that, doctor, are there any life-threatening complications of sinusitis if not treated?
So sinusitis, as I said, in acute sinusitis you can have infection, superadded infection in addition to the chronic sinus condition.
Yes.
As you know that the sinuses have very important neighbors. So if you look into the if you look at the sinuses, they are related, very much closely related to the eyes, closely related to the brain. Their neighbors are very important, sensitive neighbors. So any kind of infection which can overflow from the sinuses, and it can reach to the eyes, it can reach to the brain. So basically it's all about infection in the nasal or the sinonasal area, which can actually spread to the neighbors, mainly to the eyes and brain. So that is one of the dreaded complications of sinusitis. It can lead to abscesses inside the eyes. It can even lead to abscesses inside the brain. So it's all about an infection which is not limited just to the nose and sinuses, but which can spread to the neighbors and cause havoc. So those are the dreaded complications of sinusitis, and especially if you don't treat that in timely manner, you might end up even serious complications related to sinusitis.
Yes. So lastly, doctor, if you have anything, any key takeaway message that you want to reach out to our audiences regarding sinusitis, I'll give you a minute.
So as I have already mentioned, I want to reiterate that when you have sinusitis, it's important to differentiate what kind of sinusitis you are having, whether you are having allergies-related sinusitis, or whether you have a sinusitis where you have some extra growth inside the nose in the form of polyp. So the treatment, whatever remedies you are going to take, will depend on the type of sinusitis you are having. If you are having allergies, you have to treat that. If you are having an extra growth inside the nose, you have to treat that. So ultimately the treatment, it cannot be a universal treatment for all, but the treatment of sinusitis based on the type of sinusitis that you are having, it has to be tailor-made, and if it is tailor-made, then it can give you very satisfying results in the long run.
Yes. Thank you so much, doctor, for your invaluable insights on sinusitis, and we hope this episode has provided our viewers with a better understanding of this common condition, its causes, symptoms, and the effective ways to manage sinusitis. And to the viewers watching, if you suspect you have sinusitis, please consult healthcare professionals for proper diagnosis and treatment. And that is all for today. Thank you so much for tuning in, and until next time, take care and goodbye.